Okay, so today we're going to review how to open up a new tank of oxygen and ensure that you've done the safety checks that you need to ensure your oxygen is flowing. So your new tank is going to be in your green basket. So these are the ready-to-use tanks. They're above 500 psi. We are getting some new oxygen tanks in a couple of weeks, so this will change, but this is current for today. You're going to remove the plastic. So on the top here, this is your dial for increasing the level of oxygen, and you can hear that hissing sound. And then on the side is where you're going to see the open and close. So to open, you're going to turn it to the left. Okay. So now, to turn it on, to make sure that your oxygen is flowing, you want to hear that hissing sound. So this is how you turn up the dial. So this is 2 liters. You can hear that hissing, it's pretty loud. So if you hear that, that is how you know the oxygen is flowing. And you can increase and decrease. And one other thing, this is a nursing intervention, meaning your transporters and your techs should not be manipulating oxygen. This is a nursing requirement. Someone with a license has to do this. So you cannot have your transporter or your ClinTech do this. This is nursing. One other thing, just to review. So with COVID patients, a lot of our patients are on a higher level of oxygen. So they might be on, this is called an oximeter. So these are the little prongs that go in the nose. And it can come like this with a pendant, or you can have a different type one. This one here looks like a mustache that goes across the face. So if you had a patient that wanted to get up out of bed and have a little more slack on their tubing length, you can use one adapter, just one, to give you a little more extension, and then use the green extension tubing, 1. You cannot do 4 or 8 because then you're decreasing the amount of oxygen the patient is getting. So
do not tape them together.
Do not tape them. There are these little extenders that we can get from respiratory therapy. They just came in. So you want to use this and 1 extension max. One other thing is if your patient is over 6 liters, on more than 6 liters of oxygen, then you want to be contacting your respiratory therapist and just kind of letting them know. So that way they have them on the radar to, assess and troubleshoot. That's it.